dealing with the muscles of the forearm, and there are several muscles in the forearm, and the best way to understand all these muscles is to organize them in a systematic way. We start with the anterior compartment of the forearm, then we take the first layer, which is the superficial layer, then we move to the intermediate layer, and then we proceed to the deep layer. For the superficial layer, the first muscle that forms the lateral aspect or border of the cubital fossa is brachioradialis. So sometimes this muscle is not always grouped as the forearm muscle, okay, but it is one of the largest muscles that begins or that originates from the brachial, which is the humerus, straight down to the radius. So its origin is from the humerus and it starts into the radius. And remember, this is the radial side of the arm, and this is the ulnar side, which is medial. That's the first muscle we will have to trash out. The next muscle we will look at is pronator teres. Remember, we talked about teres muscle, and teres muscles are always, and it's involved in pronation, meaning that if the hand is in this position, okay, this muscle is responsible for bringing it to this position. After the pronator teres, we move to the next muscle, and the name of this muscle is flexor carpi radialis. Flexor carpi radialis. So we have to pick the name one after the other. Okay, so it is called flexor because it is in the anterior aspect of the forearm. Then carpi because it flexes the carpal bones. Radialis means that the point of its insertion, you see that it moved from the medial aspect of the elbow straight towards the radial side. So the next muscle is called the palmaris longus. Okay, palm. So it inserts into the palm and it's long. Look at the length of this muscle. Longus, long. So in Greek, a very long muscle is called longus. The opposite of longus is not shortus or shortus. The opposite of longus is brevis. Longus in Greek means long belly, but the opposite is brevis, that is short belly. Long belly, short belly, originating from around the medial epicondyle, and then it starts into the proximal part of the palm around the carpal. So we hide that again. That's palmaris longus. So we've done pronator teres, followed by flexor carpi radialis, then palmaris longus follows. Then the next will be flexor carpi ulnaris. So this is on the ulnar side. So you see this muscle is on the medialmost anterior side of the forearm. It originates from the medial epicondyle as well as the olecranon process and inserts straight into the head of the ulnar bone. Flexor, meaning that it's in the flexor compartment. Carpi, meaning it's acting on the carpal bone. Ulnaris, it's towards the ulnar side. So flexor carpi ulnaris. So we are done with the anterior first layer, and the muscles we've considered are the brachioradialis, pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So the mnemonics to learn the muscles in this layer is this. Brachioradialis, let's give it the name of a person, Brian. Then the next one, pronator teres, pass. Then the next F, flexor carpi radialis, fail. That means that stands for fail. Brian, pass, fail. Then the next one, palmaris longus. So the first P is pronator teres, the second P is palmaris longus, and this stands for another pass. And the next muscle is F, fail. Brian, pass, fail, pass, fail. Brian, brachioradialis, pass, pronator teres, fail. Flexor carpi radialis, first. So we deal with radial first. Then the second pass is palmaris longus muscle, and F, which is the second fail, and that is flexor carpi ulnaris. So we are set to the superficial layer of the anterior compartment of the forearm. So after we've concluded the superficial layer, that's Brian, pass, fail, then we move to intermediate layer. And this intermediate layer is simple because it is just a single muscle. And the muscle of the intermediate layer is flexor digitorium superficialis. Okay, remember we're in the anterior compartment of the forearm, and that's flexor. Okay, now digitorium, meaning that it deals with the digits, flexor digitorium, and then superficialis, meaning that the muscle is in the superficial aspect of the forearm, that's superficialis. Digitorium, digits, flexion, to flex, then superficialis, that's in the superficial layer. So there will definitely be a muscle underneath it. What will be the name of the muscle underneath flexor digitorium superficialis? So opposite of superficialis is profundus. So profundus is below the superficial muscle. What does this muscle do? let me isolate it. You see that it arose from medial epicondyle of the humerus and also in the middle shaft of the radius, and inserts straight down into the proximal phalanges just to act on digitorium digits. Now, which digits is it acting on? Look at the blue color. It acts on the index finger, middle finger, ring finger, and the little finger. So it acts on these 4 fingers. The muscle that deals with this is different. So it acts on these 4 fingers. And here is the tendon. Okay, the first, second, third, fourth. This for the index finger, middle finger, and the ring finger, and for the little finger. So this flexor digitorium superficialis. That's the only muscle in the intermediate layer. That's just a single muscle, flexor digitorium superficialis. So we'll move to the deep layer of the forearm. The first muscle we have to consider is the muscle that is underneath the flexor digitorium superficialis, and the name of the muscle is called flexor digitorium profundus. Profundus is opposite of superficial. That means that the muscle is lying below the superficialis. So this superficialis and this will be profundus. Profundus means deep in Greek language, profundus. So this is profundus, and then it flexes the digits. You will notice that if you make this movement and you feel your forearm, you will know that there are some deep muscles that are acting, not the one on the surface, but the muscle that are acting are deep. So this is the flexor digitorium profundus. It also has 4 tendons, okay, and that's for the index finger, the middle finger, the ring finger, and the little finger. So after flexor digitorium profundus, then we'll move to flexor pollicis longus. So when we are dealing with pollicis, that is the thumb pollicis. So this is flexor pollicis longus. So it flexes the pollicis. Now the thumb is called pollis. This muscle is long, so that means longus. Okay. During the discovery of all these muscles, first anatomists, early anatomists, they discovered that there is a muscle that is in the anterior aspect, so they gave it flexor, and this same muscle inserts into the base of the pollicis, that is flexor pollicis. They also discovered that this is not only the same muscle that is attached to the pollicis, there is also another short-bellied muscle that is attached to the pollicis. So they have to give some disparities. The long one is going to be pollicis longus, and then the short one, which is also inserted into the same place, will be brevis. So that's why there will be 2 muscles doing the same function, pollicis longus, pollicis brevis, if they are both flexors. It's inserted deeply into the pollicis, and that's the thumb. Look at where it is inserted. At this region of the pollis originates here. So the origin is from here, the proximal part of the ulna, and then straight into the distal phalanx of the pollis. So this is the brevis, flexor pollicis brevis. So when we start with the muscles in the palm, then we will consider the flexor pollicis brevis. But for now, we can only see flexor pollicis longus in the forearm. So we'll move to the arm later. So the last muscle in the deep anterior layer is the pronator quadratus muscle. This pronator quadratus moves the hand from pronation to supination. Okay, it's moved from pronation. This is pronation, the movement to supination. It's called quadratus because it has 4 sides. We can see the 4-sided muscle. Quadratus, like quadrilateral. Quad is 4. Okay, so that's 4-sided muscle, quadratus, and it's acting as pronator. Pronator quadratus and pronator teres helps in moving the forearm from supination position to pronation position. And with that, we are done with the muscles in the anterior layer. Now, for this deep group of muscle, the first muscle we've dealt with is flexor digitorium profundus. That's the one below flexor digitorium superficialis. Then we moved to flexor digitorium profundus, and then the next one, flexor pollicis longus, flexor pollicis, and then the next muscle is pronator quadratus. Which mnemonics do we use for these muscles? Now remember that they are all deep anterior muscles. So the mnemonics for this is deep, okay, deep fingers prefer, that is profundus, quality, that is quadratus. So we pick the first and the second words from this muscle. Deep fingers prefer, as flexor pollicis longus, quality, PFF or FPF. So the first mnemonics is deep fingers prefer, that's flexor pollicis, quality, that's pronator quadratus. So with that, we are done with all the anterior muscles in the forearm. This is the posterior compartment of the upper limb. We are through with the explanation on the anterior muscle. The best approach is to pick the muscle from the lateral and then start studying it towards the medial side. So the lateral aspect of the forearm is this thumb side, which also corresponds to the radial aspect. And the strategy is to divide it into layers. Okay, So the posterior compartment of the forearm can be divided into two layers, and the first layer is the superficial layer, and then that's superficial posterior compartment, as well as the deep posterior compartment. So start with the superficial posterior compartment. That is where the brachioradialis muscle comes in, right on this side. And the brachioradialis muscle is a muscle that arises from the brachial aspect, which is the arm, which is also the humeral bone. Then it starts straight down into the radius or radial bone. So that is brachioradialis. The next muscle to consider is extensor carpi radialis longus. Okay, it's a long name, but let's consider it one after the other. Okay, extensor, meaning that it's located in the extensor side of the forearm. The next is carpi, meaning that we are extending the carpal bone. Okay, we extend the carpal bone. Radialis, that means that it's inserted into the radial side. Okay, this is the lateral aspect of the forearm, and it's inserted down here into the radial side. So it's inserted around here. Okay, originated from here. This looks like the supracondyle. This muscle is originated from the supracondyle of the humerus. It's called extensor carpi radialis longus. Longus meaning that it's an elongated muscle. Now I've explained the reason why it is extensor posterior, carpi where it is inserted into, which is in the carpal bone. Radialis meaning that it's towards the radial aspect. The next is going to extensor carpi radialis brevis. So you see that the brevis is lying behind it. Okay, after we consider the radialis longus, then we move to the radialis brevis. Look at where it is inserted into. Here is the muscle, extensor carpi radialis brevis. So it's inserted into the carpal bone. That's extensor carpi. And radialis on the radial side. So now it's brevis because it is shorter than the longus. So the longus originates from the supracondyle, or the proximal attachment of it inside the supracondyle. However, for the brevis, it's began its attachment from the lateral epicondyle and then straight down into the carpal bone. The next muscle to consider, extensor digitorium. Now this is the extensor digitorium, and the rule is to extend the digit. Remember, flexor digitorium superficialis, and the one below it, flexor digitorium profundus. All right, now this is extensor digitorium. Okay, look at it. 1, 2, 3. So in the extensor part, it inserts into the index finger, the middle finger, as well as the ring finger. So these three fingers are being controlled by this muscle, extensor digitorium. Where does it originate from? Right from the lateral epicondyle. Then it inserts into proximal. This is the proximal, this is the middle, this is the distal. Proximal phalanx. That is the point of attachment of this muscle, extensor digitorium. So the next muscle to consider is extensor digiti minimi. Now, when we are dealing with extensor, we have to be specific with the type of digits. Remember that extensor digitorium is these first three fingers, index, middle, and ring fingers. Now, there is a special muscle for the digiti minimi. This little finger is called digiti minimi, and that is the Greek translation for little finger. So little finger means digiti minimi. This is where it's originating from, lateral epicondyle, and straight down to the proximal phalanx of the little finger. The last muscle in this superficial layer is extensor carpi ulnaris. So the next muscle is extensor carpi ulnaris. Okay, it's carpi ulnaris, meaning that it inserts into the carpal bone. It inserts into the carpal bone, and then it's on the ulnar side of the forearm, which is the medial aspect, crossing over to the medial side to insert into the carpal bone. And this is the little finger. So this extensor carpi. Now we are done with the superficial layer of muscle. So let's go for the mnemonics for this muscle. Mnemonics for this is brachioradialis, which is the B. The two extensors, which is extensor carpi radialis longus, and the second variant, which is extensor carpi radialis brevis. Then the R, that is the radialis. Next is D, which is drinks, that is 2D, that is digitorium and extensor digiti minimi. Extensor digitorium and extensor digiti minimi. So that's 2Ds, DS, extensor digitorium and digiti minimi. Next is can't cause, that is carpi, extensor carpi, cause, can't cause ulcer. So beer drinks can't cause ulcer, and that is the mnemonics for the superficial layer of the extensor muscle. So beer drinks, that is B, brachioradialis. This is for the brachioradialis. Then EER, extensor radialis longus, extensor radialis brevis. Drinks, digitorium, drinks, extensor digitorium, and the second drink is extensor digiti minimi. That is 2D. These drinks, extensor digitorium and extensor digiti minimi. Can't cause, that is extensor carpi ulnaris, extensor carpi. So that's extensor carpi. Can't cause ulcer. So ulcer stands for ulnaris, ulnaris. So that's ulcer ulnaris. So that's it for the superficial layer of posterior muscle group. So let's move to the deep layer of the posterior muscle group. So the first muscle that we'll consider, you see, always remember that you are starting with the thumb or the radial side, the lateral side, then you read it towards the medial side. First muscle right here is supinator muscle. So it moves the hand from this point to this point. So this muscle is responsible for this movement, and this movement is called supination. Okay, supinator muscle. So that is S, that is supinator muscle. That's the first muscle, which is on the medial and proximal aspect of the ulna, as well as the lateral epicondyle. It inserts into the shaft of the radius. Now, next is going to be abductor pollicis. Long muscle that does this action is abductor pollicis. So this is the abductor pollicis longus because it is long. That means there's definitely going to be the brevis, and the brevis is in the palm. Okay, so if this is abductor pollicis longus, the brevis will be located right here, abductor pollicis brevis, which is shorter. So the shorter one is among the thinner muscle, but the abductor pollicis longus is on the forearm and the posterior aspect. Look at where it is originating from, or the proximal attachment. Okay, it's on the shaft of the ulnar bone. It inserts into the proximal phalanx of the pollicis, which is top A, abductor pollicis longus. And the next muscle is going to be extensor pollicis brevis. There's extensor pollicis longus and there's extensor pollicis brevis. So this is extensor pollicis longus right here, straight to the pollicis, and look at the muscle beside it. There's the muscle beside it, extensor pollicis brevis. So these two muscles are extending the pollicis, that is EE. The last one is extensor indicis. Extensor indicis. Now remember that this extensor stands for the pollicis, PEE. So there's still one more extensor, which is extensor indicis, to extend the index. Okay, extension of the index finger, that's extensor indicis. So look at the extensor indicis muscle right from the lower part of the ulna or the shaft, then straight down to the proximal phalanx of the index finger. And with that, we are done with all the muscles in the posterior aspect of the forearm. How do we match up these mnemonics? SAPEE. First is supinator muscle. Okay, next is abductor pollicis longus. Next is extensor pollicis longus, extensor pollicis brevis, extensor indicis. And with that, we've concluded all the muscles in the forearm.